Bismillahirrahmanirrahim. My name is Dr. Awais Naeem. I am Assistant Professor and Chairperson, Department of Medicine, Khyber Teaching Hospital. I remain the focal person for COVID-19 pandemic as well as dengue epidemic in the respective years. Today the topic, the basic concepts of healthcare quality and infection prevention, is under discussion. Well, these two, healthcare quality and infection prevention, are essential components of the modern healthcare system. And we are going to discuss the basic concepts regarding those. Healthcare quality encompasses various aspects in which we have effectiveness, safety, timeliness, efficiency, as well as patient-centeredness, which on a whole looks at the patient outcomes and experiences while maximizing the value of healthcare services. When it comes to infection prevention, it focuses on minimizing the risk and spread of infections within the healthcare settings, safeguarding both the patients as well as the healthcare workers. Together, healthcare quality and infection prevention forms the cornerstone of robust healthcare system that prioritizes patient safety as well as enhances the overall healthcare outcomes. While understanding the basic concepts, the terminologies of effectiveness, safety, timeliness, efficiency, and patient-centeredness will come along. Effectiveness, the aspect actually focuses on providing evidence-based care that achieves the desired health outcomes in the patient. It utilizes the most current knowledge and best practices in medical treatments and intervention. The second term we commonly come across is safety, and in healthcare quality it emphasizes on the prevention of harm to the patient through the implementation of safety protocols, whether it's in terms of medical management, infection prevention and control practices, or various checklists or other preventive measures. Timeliness is the term that ensures that healthcare delivery is provided in time to the patient without much waiting time. And this involves reducing the waiting times, optimizing the appointment scheduling, and addressing the emergencies promptly. Efficiency is the efficient healthcare delivery that aims to minimize the waste, reduce unnecessary procedures or testing, and streamlines the processes to utilize the healthcare resources effectively. It involves optimizing the workflow, utilizing the technology, and ensuring the appropriate allocation of resources. And the other term that will come across is patient-centeredness. This concept highlights the importance of involving patients in their care decisions, respecting their values and preferences, and providing compassionate and empathetic healthcare experience. This emphasizes effective communication, shared decision making, and individualized care. The basic concepts of the healthcare quality provides a framework for assessing, monitoring, and continuing improving of the overall care that is delivered within the healthcare systems, with the ultimate goal of optimizing patient care outcomes and experiences. Well, infections has a great impact in healthcare settings. Hospital-acquired infections is a common entity these days, and this is a worldwide pandemic in itself. There are various types of hospital-acquired infections, like bloodstream infections, surgical site infections, urinary tract infections, and community-acquired pneumonias or hospital-acquired pneumonias. The most susceptible population to hospital-acquired infections are the elderly, immunocompromised patients, and those going invasive procedures. What are the consequences of the hospital-acquired for the patients? HAIs results in prolonged hospital stay and long-term disability, and increased resistance to mechanisms to antimicrobials, high cost for the patient and their family, and unnecessary deaths. What are the consequences for the health system? Well, the prolonged stay will have additional stay on the healthcare system financially. Hospital beds will be occupied for a longer time, and that will ultimately need more financial support in terms of medications and personnel. Additionally, one infection leads to another infection, and the spreads faster, and a vicious cycle will start, and that will actually bring more burden on the healthcare system. More the infections, more difficult it is to control. HI have a significant impact on the patient and healthcare system globally, and the prevalence of HI along with their consequences undermines the urgent need for robust infection prevention and control measures. Addressing HI effectively will not only improve the patient outcomes but also elevate the burden on the healthcare system, ensuring safer and more efficient care delivery. What's the role of World Health Organization in it? Well, WHO is a United Nations agency that connects nations, partners and peoples to promote health, keep the world safe and serve the vulnerable. So everyone has an access or attains the highest level of healthcare. It's one of the largest. It's as being the largest, having a vast reach of around 194 member states across 6 regions and around 150 locations throughout the world. WHO has a foremost responsibility to lead the global efforts against the problems incurred by the healthcare system and expand universal health coverage. Well, it does show by allowing or emphasizing with the partners by giving access to the primary care and preventable health care, ensuring access to medication and health products to the people who need it, sustainable financing and financial support protection for the people and the community, and workforce training and labor protection for health workers. So WHO has a key role to play when it comes down to universal health access for all the vulnerable patients. WHO has taken several initiatives in terms of healthcare quality, and these include Global Patient Safety Challenge, Medication Without Harm, Patient Safety Friendly Hospital Initiatives, Integrated Care for Older People, and World Alliance for Patient Safety. We'll just go into details of them one by one. The Global Patient Safety Challenge or Medication Without Harm, unsafe medical practices and medication errors are the leading cause of injury and avoidable harm in healthcare system, and it has a big global burden in terms of economy that is estimated to be 42 billion US dollars. In response to this, WHO has identified medication without harm as the theme for the third Global Patient Safety Challenge. WHO tackled this by improving framework on 4 areas: healthcare professionals, and by proper education and training, communication and teamwork, capability of providing service at the point of care, and incident reporting and learning. WHO hopes that it will achieve the targets of medication without harm. The second key area of framework was medicines, and that included improving the product quality and safety, proper naming and labeling and packaging, proper logistics, storage and disposal, and right product at the point of care. The third point was system and practices of medication that emphasize on improved leadership and governance, proper prescribing, preparation and dispensing, proper administration and patient monitoring and evaluation. And the fourth key point in improving the framework was patient and public awareness and medication literacy, patient engagement in their healthcare system, reporting by the patient and involvement of the patient organization. The other initiative that was taken by WHO was Patient Safety Friendly Hospital Initiative. It's a vital program that is aimed at fostering a safe and secure environment within the healthcare facilities. This initiative recognizes the importance of collaboration between the hospitals and the public safety agencies to enhance emergency response and ensure the well-being of patients, staff, and the visitors. The participating hospitals undergo comprehensive training and implementation for effective security measures, which include enhanced surveillance system, access control protocols, and staff training on emergency preparedness. By establishing a strong partnership between the healthcare providers and public safety agencies, the public safety the friendly hospital initiative promotes a sense of security and trust, ultimately resulting in improved patient care and overall community well-being. There are 5 key strategies to improve the patient safety, and these include leadership commitment, without which healthcare sector cannot go forward, clear policies and guidelines for the healthcare staffs, competent and compassionate healthcare workers, engaging the patients and their family in their treatment, and collecting the data, and that data will be actually used to drive the improvement. Another health quality initiative by the WHO is integrated care for the older people. Now these are the people who have different requirements, and their healthcare actually needs different challenges we face in different ways. And there are 5 key domains and which needs to be concentrated on. These include mobility, cognition, vitality, psychological well-being, and sensory function. The ICOP approach emphasizes a person-centered and integrated care model where the healthcare professionals work together to identify and address the specific needs for older individuals comprehensively. It involves assessing and managing the individual functional abilities, identify any potential risks or deficiencies, and implementing appropriate intervention to optimize their well-being. The ICOP framework encourages collaboration between healthcare providers, community organizations, and social welfare services to ensure a holistic and coordinated approach to care. By integrating health and social care services, this program aims to prevent and manage age-related declines and disability, promote an active and healthy aging, and enable older people to maintain their independence and participate fully in the society. And this represents a significant step of WHO towards improving the healthcare and well-being of older populations. The 4th initiative is World Alliance for Patient Safety. World Alliance for Patient Safety, established by WHO, is a global initiative aimed at promoting patient safety, reducing avoidable harm, and improving the quality of healthcare worldwide. It recognizes patient safety as a fundamental aspect of healthcare delivery and emphasizes the need for collaboration and concerted effort to address the patient safety and related challenges. The World Alliance for Patient Safety focuses on various aspects to enhance patient safety that includes development of policies and guidelines, advocacy for patient safety at global and national level, knowledge dissemination and sharing of best policies and practices, and capacity building for healthcare professionals and institutions. Through the Alliance, the WHO encourages countries to establish and strengthen their patient safety programs, initiatives, and systems, provides the technical supports, resources, and tools to assist countries in assessing, improving, and monitoring the patient safety in the healthcare system. Furthermore, the World Alliance for Patient Safety fosters collaboration among different stakeholders, such as government, healthcare organizations, healthcare professionals, patient advocacy groups, and researchers. It recognizes that a multidisciplinary and multi-sectorial approach is crucial in effectively addressing the patient safety and implements sustainable strategies to improve healthcare quality. Overall, the World Alliance for Patient Safety plays a vital role in advancing the global patient safety agenda, promoting a culture of safety and driving positive change in the healthcare system to ensure safer care for our patients. The next basic concept is the understanding of infection prevention. Infection prevention is a critical component of the healthcare system as it is aimed at prevention of transmission of diseases within the community. It encompasses a wide range of practices and strategies which are designed to prevent transmission of infectious agent and maintain a safe and healthy environment for the patient as well as the healthcare worker and general population. The goal of infection prevention is to reduce the incidence of healthcare associated infections as well as community acquired infections. HAIs are infections that occur as a result of receiving treatment in the healthcare system, hospitals, clinics, or other healthcare settings. These infections are usually have serious consequences for the patients, leading to prolonged hospital stays, increased mortality and morbidity, and additional healthcare cost. Infection prevention measures include various practices such as hand hygiene, using proper personal protective equipments like gloves and masks, adherence to standard precautions like safe handling of the shops, appropriate waste management, effective cleaning and disinfection of the surfaces, and implementation of the isolation precaution wherever necessary. Additionally, infection prevention involves promoting vaccination, practicing respiratory hygiene, practicing food hygiene and handling, and implementation of the antimicrobial stewardship program to prevent emergence of antimicrobial resistance. In healthcare settings, infection prevention is implemented by infection control professionals who are closely working with healthcare providers, administrators, and support staff. Their purpose is to conduct surveillance regarding infection, develop and implement policies and protocols, provide education and training to the healthcare personnel, and ensure compliance with the infection prevention guidelines. In the community, the infection prevention practices are promoted by the public health authorities, healthcare organizations, and educational institutions. They focus on raising awareness about proper hygiene measures, encourage vaccination, and provide information on how to prevent day-to-day spread of infections. By prioritizing infection prevention, healthcare facilities and communities can reduce the burden of infection, protect the vulnerable like elderly and immunocompromised, and improve the overall public health. It requires a collaborative effort between the stakeholders to create a culture of safety and implement evidence practices and continuing striving for excellence in infection prevention. WHO has taken several initiatives for infection prevention, and these include clean care is safer care, hand hygiene, global antimicrobial resistance surveillance system, GLASS, and immunization and vaccination programs. Clean Care is a Safer Care is a global initiative launched by WHO in 2005 to promote and improve hand hygiene practices in healthcare settings. The program recognizes that a proper hand care hygiene is fundamental and effective measure in preventing healthcare associated infection and ensuring patient safety. Clean Care is a Safer Care aims to raise awareness about the importance of hand hygiene and provide guidelines and tools for healthcare workers to follow, and encourage the implementation of strategies to improve hand hygiene compliance. By emphasizing the critical role of clean hands in reducing the spread of infections, this initiative strives to create a culture of safety in healthcare institutions and protect the patients, healthcare workers, and the community from avoidable harm. Global Antimicrobial Resistance Surveillance System. This was an initiative by WHO to monitor and combat antimicrobial resistance on a global scale. It was launched in 2015 with a collaborative effort from multiple countries and international partners. The main objective is to collect, analyze, and disseminate data on AMR to guide policies, development, support surveillance efforts, and facilitate the implementation and effective strategies to combat AMR worldwide. GLASS aims to enhance the understanding of global burden of antimicrobial resistance and its trends over time, as well as the pattern of resistance observed in different regions and countries. GLASS encourages the participating countries to establish and strengthen their national AMR surveillance system, which includes the collection of data on antimicrobial use, their resistant patterns, and laboratory capacity for the diagnosis of AMR. This system promotes the use of standardization methods for data collection and reporting, ensuring the comparability of the information across different countries. Through GLASS, WHO provides technical support and guidance to the participating countries, assisting them in implementing effective surveillance system and developing national action plans to address AMR. The system facilitates the sharing of data, knowledge, and best practices among countries to promote collaborative and foster global efforts against AMR. By monitoring AMR trends and analyzing the data collected through GLASS, WHO partners can identify emerging resistant patterns, detect outbreaks, and assess the impact of intervention. The information helps us in public health policies and strategies to promote appropriate use of antimicrobial agents, prevent spread of resistant infections, and preserve effectiveness of existing antimicrobial treatments. It was a significant step, a coordinated global response to an emerging pandemic, promoting a data-driven decision making and fostering collaboration between countries and international organizations in the fight against antimicrobial resistance. The third step in preventing infection is immunization and vaccinations, and they play a vital role as recognized by World Health Organization. Vaccines are powerful tools that stimulate the immune system to recognize and combat specific pathogens such as viruses or bacteria before they can cause harm. WHO advocates for the use of widespread immunization programs and promotes access of safe and effective vaccines and development strategies to ensure equitable vaccine distribution globally. The WHO advocates a widespread immunization program as it will ensure that there is reduction in the burden of infectious diseases and is likely to save countless lives. As with every developing system, there are future challenges and opportunities at the same time, whether it's healthcare quality or infection prevention. The challenges we are facing today are antimicrobial resistance, overpopulation, which is a burden on healthcare system, and emerging infectious diseases. Like recently we had COVID-19. What are the opportunities or the positive we can look at? We have technological advances. We have more collaborative efforts and more knowledge to share. We can ensure patient engagement and empowerment and make new policies and regulations. In conclusion, the concept of healthcare quality and infection prevention plays an important role in healthcare's delivery, ensuring a better patient care. Throughout this presentation, we have explored the fundamental principles and strategies and contribute to the enhancing healthcare quality and effectively preventing infections. First and foremost, we have learned the healthcare quality encompasses 5 basic steps. These include patient centeredness, effectiveness, safety, timeliness, and efficiency. By focusing on these aspects, healthcare providers can ensure optimal care that meets the expectation and needs of the patient. Moreover, infection prevention is crucial component of the healthcare system. By implementing robust prevention measures in healthcare facilities, we can reduce or minimize the risk of healthcare associated infections, safeguarding both the patient as well as the healthcare workers. Strategies such as hand hygiene, proper sterilizations, and adherence to the infection prevention and controls are vital in reducing the transmission of pathogens and maintaining the safe healthcare environment. Through this lecture, we have already also recognized the significance of multidisciplinary approach in healthcare quality and infection prevention and control. Collaboration among the healthcare workers, administrators, policymakers, and patient is essential for implementing evidence-based practices, continuous quality improvement, and effective infection prevention. Through teamwork and shared responsibility, health organizations can foster the culture of safety and constantly provide high quality of care. In conclusion, health quality and infection prevention are inseparable aspects of healthcare system. By prioritizing the patient safety, adopting evidence-based medicine, and promoting the culture of collaboration, we can strive towards delivering a healthcare system of highest quality and effectively prevent infection transmissions. Ultimately, our collective efforts in these areas will lead to improved healthcare system, enhanced patient care experience, and safer healthcare environment for all. Thank you so much.